Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us for another segment. We're going to have a conversation with Dr. Ankit Shah. He's a leading cardiologist with MedStar Health in Baltimore, Maryland, and he's joining us here on Health Professional Radio to talk about the interactive heart risk calculator that's going to help patients get a quicker and more personal assessment of their risk of heart disease, their risk of stroke, and some other cardiovascular diseases as well. Welcome to Health Professional Radio, Dr. Ankit Shah. Thank you for taking the time this morning.
Thank you for having me.
Right. A bit of background other than being cardiologist there at MedStar, and I do believe you're one of the founding members as well.
I have started the sports cardiology program for MedStar Health.
And this new tool, what exactly is this tool designed to do, and why is it important to patients?
Yeah, so it's actually a tool that is sort of been utilized and is available from the American College of Cardiology. But what has been done by our health IT folks is actually incorporating it directly into our electronic medical record. So it makes things a little bit more efficient for us as physicians or providers, and also provides more of a visual for the patients. So the calculator actually is able to extract the data directly from the patient's chart and give us the numbers. So it gives us a risk calculator for their risk of stroke or heart attack over a 10-year period, using data such as their cholesterol levels, their blood pressure, if they smoke or not, and if they're on certain types of medications. And so this is automatically done by this app that's been embedded into the medical records. And so when we see a patient, we open up their chart and this pops up. And so one, it's a bit of an alert for us as a provider to say, okay, have we addressed this? Is this something we need to talk about? And then second, it provides a visual for the actual patient, so you can turn your computer screen around and show them that this is what their risk is. And then based on certain changes of their lifestyle or medications, we can show how there can be adjustments or decreases to their risk over time.
Now, this is done strictly using electronic health records. Is that correct?
That's correct.
For the patient, there's no physical testing. There's no additional testing or anything that is needed in order to use the app.
Well, this assumes that they've had some data in the past, such as like a cholesterol drawn, and then they've had the blood pressure done when they first check into the office. But otherwise, it's more of a question if they have a history of diabetes, if they're a smoker or not. But there's no additional sort of cardiac testing.
Where does the information, the electronic health record, are we talking about there at your facility? Are we talking about things that are online, things that are public record? I mean, how does it actually work with all of the different facilities that a patient may or may not have come in contact with?
So as far as I'm aware, this is only at MedStar Health. So if the patient were to go to an outside health system, I'm not sure, what specific protocols they have. But for a patient who walks into MedStar Health, whether it be in Washington, D.C. or in Baltimore, it's the same electronic health record. And because of that, we are able to utilize the same information. And so this app will pull the data from anywhere.
So it is strictly a MedStar Health System app?
Correct.
Do the patients have to qualify in some type? Is there some type of, you say it's flagged to let you make a decision as to whether you've addressed something or not? Are all patients thrown into the same database, or are there certain patients that are put into the database specifically for this app?
We generally do this. It's more of a preventative, an opportunity for us to talk about some preventative measures or some lifestyle changes to reduce the risk of having heart attacks or strokes. So for patients who've already had heart attacks or strokes, this is not necessarily applicable because we're going to be treating them in a separate condition. But for folks who don't have those conditions already, this is a nice tool to say, hey, you haven't had a heart attack or stroke, but your risk seems, your 10-year risk seems super high. What can we do to minimize that risk? And one of the nice features of this tool is that it actually has a sort of a visual of, you can say, okay, I'm currently a smoker. If you were to stop smoking, what happens to your risk over 10 years? And it shows the patient these changes. So I think it's a nice visual. It supports what we as physicians or providers are telling the patients in terms of recommendations, but now provides them something to look at.
How many physicians would you say are currently using this tool?
It's available to over 500 of our physicians.
Most older adults have lived a lifestyle where there's possibly some risk. But what about younger patients in the MedStar system? Does it also give them some early tips to prevent some things in their 40s and 50s?
Right, exactly. It's more of a signal for us to say, hey, if you're in your 40s and 50s, this risk calculator is saying your 10-year risk is in the highest range or in the moderate range. What can we do to change it? So again, it alerts us as the providers that there's either this patient's higher risk, and then we have the conversation and saying, what can you do to change, whether it be diet, exercise, weight loss, to improve their cholesterol, to improve their blood pressures, and then that all brings their risk down.
What type of feedback have you gotten from patients as they see this new tool rolled out for their benefit?
Yeah, I think they're very pleased with it. I think it's a nice way for them potentially to see change over time, and also for them just to be able to visualize when we say high risk or moderate risk, or say you're at risk. This is a nice way to say, hey, look, there's some supporting evidence, and you can see potential changes in how your risk is going to be adjusted.
Does this tool promote an easier conversation for the physician to maybe start, or the patient to start some of these conversations about lifestyle that maybe hadn't been an issue before? Some of those conversations can be difficult to start with your healthcare provider.
Absolutely. It potentially, and also it may allow patients to be more candid about what they are actually eating and drinking potentially. But on top of that, I think it definitely allows for sort of us to engage them a little bit more directly, given this visual.
Right. Well, I'd like to give our listeners a website where they can get some more information about MedStar Health and about this new tool for making some quick personal assessments about your risk of heart disease. I
would direct them just to the www.medstarhealth.org. In terms of this tool, and again, I'm not sure it's forward-facing for the patient. I think it's directly for the physician.
Thank you, Dr. Shah, for speaking with us this morning here on Health Professional Radio.
Thank you very much. Have a great day.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this conversation are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.